Good morning and welcome to COVID-19 Talk with local health authorities. With us is Dr. Maria Rivera from Harris County, Dr. David Persse representing the City of Houston. Special thanks to past President Kathy Finnegan, Rotary Club of Houston, and we're glad to have Morgan back with us today. I'm Stephen Williams, Director of the Houston Health Department. Transmission is first a set of questions. It's been reported that 19% of the population has been vaccinated and 31% have had the virus, which looks like 50% of Texas has some type of immunity. Is that correct? Please update the current numbers.
So I'll take a stab at that because I just happened to look this up this morning. In fact, I look it up most mornings. But in Texas, across the state, we now have got, for people age 16 and over, there's just over 50% of the folks who've got at least one shot. And it's about 37% of the population have got two shots. Now, if you look at, and that's for 16 and over, if you look at all, you just take off about 7% of that. So the 50% drops down to about 42, 43%, and the 30% drops down to in the low 20s. We don't really know what percent of people have got immunity from previous infection. We did actually here in Houston, Harris County, along with the CDC, did a prevalence study back in back in November. And so we can guesstimate that by now, which probably maybe another 20+% of people have got some immunity. But here's the important thing to also remember is that the immunity, the CDC just this week came out and showed that the immunity from natural infection is far less potent than what you get from vaccines. So we'll have to wait and see. So that's the current numbers.
Okay. I'm so confused about how we're doing. One graph shows numbers leveling off, and yet the details appear to show an increase in new cases reported. Are we interpreting numbers to show only who has tested positive, or are we multiplying the actuals by 4 because not everyone tests?
Yeah, so I can take this one. We're reporting the numbers of people that have tested positive. And I think overall, the trends that we're seeing is that we did start, we were decreasing after the winter surge. So after December, the winter holidays, Christmas, et cetera, we started decreasing. And it really looks like in the last couple of weeks, we have plateaued. And so if you look at the data really, really closely, sometimes it looks like we're going up, sometimes it looks like we're going down. But if you look long over a couple week period, it really looks like we're staying steady. And I think the thing that's concerning to us about that is that we're steady at a higher level than we were before any of these surges. And so that just tells us that we need to continue to keep vaccinating. We need to continue to wear our mask. We need to continue to be distanced from others and avoiding large groups, because even though we had been going down, we're not at that peak level where we were in December, January. We now have leveled off at a slightly higher rate than we would like.
MIT reports the risk of being exposed to COVID indoors is as great as 60 feet as at 6 feet, even while wearing a mask. So why wear one?
Yeah, this is a great question that goes to people having to understand there's, if you think about the transmission of the virus, you need to think of it in 3 different modes. One is, if you're less than 6 feet, that is generally when you're within the range where a droplet from one person's mouth could actually get into your nose, into your mouth, into your eyes, especially if they were to cough or sneeze or something along those lines. So the mask really prevents the transmission when you're within 6 feet. Beyond 6 feet, that's where we start talking about aerosol transmission. So this is the really tiny particles of really your exhaled air that contain virus in it. They get into the room and it floats around the room. And so how much virus there is floating around the room is dependent on how much air exchange there is, whether there's any ventilation or air circulation. So, is the air just being circulated within the room, or is it actually being exchanged with outside air? How many people are in there? And then wearing masks actually does slow that down a little bit, but the big point is that beyond the masks really help that transmission, because the biggest form of transmission, the most common way to get it, is from somebody within 6 feet of you who's just simply talking. There's enough droplets that'll get out that far just within 6 feet. So that's why we wear the 6 feet. And then the third way is that getting it off of doorknobs and things, which we've come to learn is actually pretty minimal with this particular virus. It's very prevalent with other viruses, but with this one, that doesn't seem like be a real common way to spread the virus.
New mask rules from CDC do not seem to differ from how we're dealing with them in Texas. Am I missing something?
Yeah, so the new mask rules from CDC are really the main difference is that it's for people that are already vaccinated. And the person who's asking this question is correct. I think it varies between state to state what the mask mandates were, what the mask rules were. And in Texas, masks weren't mandated outside. There are other states where masks are mandated outside for everyone. But right now the CDC is saying that if you're vaccinated, you do not have to wear a mask outside, and there's other instances where you don't have to wear a mask if you're among other vaccinated people, et cetera. And so it's not that different in Texas, that's correct, but for the country as a whole, it's a different position.
Do you agree with the new mask rules for elementary school children? How have schools been doing with numbers of cases?
We usually go back and forth, but I'm going to defer to Dr. Rivera on this because she's been so heavily involved with the schools and children.
Yeah, and so I'm not exactly sure what new mask rule is the person submitted the question is asking, but in general, the recommendations for masking in schools are that all children over the age of 2 should be masked. What has changed a little bit recently from the CDC in regards to mitigation measures in schools is how close together kids may sit. And so we now realize that that 6 feet of distance really applies more to adults and kind of how far a cough or a sneeze can go in the very close vicinity. And for children, we think it's now, they can sit closer together at around 3 feet. That is still masked. That's not that kids should sit 3 feet apart without masks. And the older kids really should sit 6 feet apart unless the community transmission of COVID-19 in their communities is low. So in general, what we have seen in Harris County is that the numbers of cases and the clusters, the outbreaks that we've seen, a lot of the times they're related to times when the kids weren't masked, when there were too many kids close together, when they were engaged in extracurricular activities, or when they were engaged in sports. What we've seen is that when schools follow these mitigation practices, the chance of transmission within the classrooms is fairly low. When they really can get into trouble is when all these measures are not followed. And so in general, I think the numbers in schools have been good because schools have been following all these measures. And so our recommendation is to continue. Just because we're doing better and just because the cases are low, it doesn't mean you should get rid of the mask. It doesn't mean you should put the kids all close together. It's because of these measures that the schools are doing well.
The EU is not exercising its option to purchase up to 300 million doses of vaccine from AstraZeneca and J&J, and are looking to purchase more Pfizer. What is our takeaway from this?
Yeah, this is a difficult situation. I think that there has been an awful lot of hype about the problems that have been, the really tiny number of problems that have been detected with the AstraZeneca and the J&J around clots. A couple of things for people to remember is that you have a much greater chance of developing a serious, life-threatening, or potentially fatal clot problem if you get infected with the virus than you do from the vaccines. And the vaccines, this clotting issue, first of all, it is literally a 1 in a million complication. So the good takeaway is that we were able to detect that. It is really, really small. And here's the other problem for the EU, which may then translate into a global problem, is that the AstraZeneca and the J&J vaccines, they're far less expensive and they're single dose. And so there are communities for whom it's difficult to get 2 doses into because they move around so much or what have you. And my fear is that there will be a lot of people who will go unvaccinated because of this decision. But fortunately, here in the United States, we do have the J&J, and through health departments like ours, we're going to be getting into those neighborhoods and hopefully get as many people vaccinated as possible. And at the end of the day, whether it's Pfizer, Moderna, J&J, AstraZeneca, the goal is to get people vaccinated. That's how we get out of this pandemic.
FDA ended J&J pause and will add a warning regarding clots. Should we read this that it's okay for those over 18 to take it and assume the risk, or should only women 50 and over get it? One male under 60 has had a potentially connected blood clot. So what would the guidance for men be? I think you just said that.
Yeah. Yeah, if you don't mind, Dr. Rivera, I'll go two questions in a row. The point is that these are really, really rare complications, and I don't want to get too much into it, but it's an uncommon clot that is only occurring in people who have really, really low platelet counts, which is also really uncommon. So you got two uncommon things happening, and then there seems to be that the vaccine might be setting it in motion, because this situation of getting clots in people with low platelet counts, that happens anyways. It's really rare, but it seems like it's a little bit more common with folks who've just been vaccinated, but it's literally 1 in a million. And there also appears to be this predominance that it's occurring in women, which we really haven't figured out why women just yet. So certainly at this point for men, I wouldn't hesitate at all. If I was a woman, I wouldn't hesitate from getting vaccinated with the J&J. The point is, you got to get vaccinated. Your problems with the virus far outstretch any problem you might possibly have with the vaccine.
And I think I should add that there is still a demand for J&J because it's a one-shot vaccine. What locations will now get the J&J vaccine, and will there be a warning at those sites so we can decide for ourselves which one to get?
Yeah, and so we can only speak to some of our own sites. And so, for example, NRG Stadium is already administering Johnson & Johnson vaccine again, and it's very, very clear when you go to register for a vaccine, if you register for an appointment beforehand, which vaccine you're registering for. You get to choose which vaccine you're registering for. And once you show up to NRG Stadium, there's only specific lanes. So there's specific lanes for Pfizer, and then there's specific lanes for J&J, so there's no confusion. The vaccines are transported separately. There's color-coded carts and everything, so that there isn't any confusion. And people know exactly what vaccine they're receiving, and they are told right before, do you know that you're receiving the Pfizer vaccine? Do you know that you're receiving the Johnson & Johnson vaccine, et cetera? And so that's how that's being managed, I think, with a lot of places around the county. And I'll let Dr. Persse or Director Williams answer specifically about the city of Houston, but one of our shared sites and the FEMA site, NRG, that's how it's being handled. But for the most part, you'll know in advance, if you register for an appointment, which vaccine you're going to receive.
And that's the same for the city of Houston. I mean, we notify people exactly what they're getting. I've had a choice about which vaccine to get. What is the best at dealing with the variants?
Yeah. So, the variants, it's a bit of a moving target, but from the variants that we are seeing here in the United States, the UK variant being the most predominant one, which is over 70% of the virus that we're detecting, both in clinical samples from our colleagues at the hospital and also in the wastewater. So the three vaccines, the Moderna, Pfizer, Johnson & Johnson, seem to have good efficacy against the B117 UK variant. We have less experience with the South African and the Brazilian, although in the laboratory it looks like it has good protection, but we need to find out from actual clinical experience. But my first comment about variants being a moving target is, as time goes on, there are more and more variants that are going to become part of this equation. Again, that's a reason why we as a population of human beings on the planet known as Earth have got to get this pandemic under control in every nook and cranny that we can, or eventually there's going to be variants that will be able to get around the vaccines, and we don't want that to happen.
Sports teams need to be regularly COVID tested. Why don't people who are getting off planes or coming into the country by other means have to do so?
So they do. So anyone who's entering the United States internationally has to present a negative COVID test prior to entering, or typically they're not allowed to board the plane. And then the recommendation from CDC is that once they arrive, they need to get tested as well. Granted, not everyone gets tested after they arrive, but they do need to have a negative test and present a negative test in order to enter.
VAERS, Vaccine Adverse Event Reporting System, is a government database that appears to be voluntary for physicians and patients to report their COVID data. How does that connect to vSafe operated by CDC? Are we supposed to report to both? What about numbers in both systems? Do they overlap and can duplicates be deleted? How would we know about this? I learned about vSafe after getting my vaccine. Long question.
Yeah, it's a long, complicated question. I'll try to give a fairly straightforward answer. So the VAERS reporting system has been in place for many, many years, and it is voluntary, which means that it has a really wide net. It catches lots of reports. That's the upside. The downside is that when people report, they don't always put in a whole lot of data, and many times when they report vaccine problems, they can be reporting things which are not vaccine related. So, for example, there are cases in there of people who got vaccinated and then 6 weeks later died of a heart attack. And people reported that, making the assumption that it had something to do with the vaccine. And this isn't, I'm not talking about the COVID vaccine, I'm talking about any vaccine. And so, you got to be a little bit careful as you look at VAERS because it's so open. vSafe is the new system that the CDC put together so that when you get get vaccinated with COVID, you can sign up to participate in that, and then they will then contact you on your smartphone daily and then weekly, to see if you want to report. So it's a little bit more proactive. So VAERS is a little bit passive; it waits for people to report. vSafe is more proactive because it asks you questions on a daily and then weekly basis. And so they do cross-reference those. The CDC does cross-reference those, not in order to. They can't do it on a case-by-case basis necessarily, but they do cross-reference looking for, the important thing is looking for trends, and if we have anything, that pops up that was not anticipated. And that's how I would answer those questions.
If Pfizer receives full FDA approval, it appears they can market to the public. Would this require payment by the consumer, or will the vaccination still be free? If so, for how long?
That is a good question that I do not know the answer to. Typically, the way the vaccines are being handled, that they're being provided at the federal level, and at the federal level, they've been made free. And so I don't know, Dr. Persse, if you know about what the decision is once they become fully approved. I anticipate that they're going to continue to be free. But yeah, it's a good question.
Yeah, I anticipate they're going to be free at some point. That will stop, but we'll have to wait for the federal government to make that decision.
The new Pfizer pill is in phase 1 trials. Can that be used to supplement the vaccine as a pre or just to treat an existing case?
Yeah, so this Pfizer pill that is being investigated they just finished the phase 1 trial. Remember, phase 1 trial is where they give it to a very small number of people, maybe around 100 or 200 people, to see if they have any unexpected bad reaction to the pill. It really is looking to see how effective it is. And this is really, a pill, it's an antiviral. So similar to other antivirals, think of like Tamiflu. It's something that you would generally, the first time it's being used clinically would probably be used with people who, when they very first have symptoms. And so it's not a replacement for vaccination. And just like Tamiflu, at some point, when certain populations, they may recommend it as prophylaxis, but for the most part, it's going to be, once you get exposed and you think you have symptoms. I anticipate that's what it has to go through a lot of things. We'll have to wait and see what the final indications are. That'll be based on the phase 2, phase 3, phase 4, phase 2 and phase 3 trials.
Harris County Public Health partnered with Cy-Fair school districts to give vaccines to those 16 and over. Any plans with HISD or other districts?
I can take this one. So we did partner with Cy-Fair ISD this week to vaccinate teenagers, and that's the one that was on the news. So it makes it seem like that's the only school district that we partnered with, and it's because it is the biggest district in the Harris County Public Health jurisdiction. And we have had a very successful partnership this week. We also this week are at Spring ISD as well, and have been partnering and have been setting up vaccine clinics with, at this point, pretty much every school district in our jurisdiction. And I know that the city is starting to do the same as well. And so the plan is for all the different partners and all the different vaccine providers in the area to come together and make sure that we are giving that option to the schools if it's something that they want to do, and in that way bring as much vaccine as possible to the schools to vaccinate those kids before they go out for the summer is our goal.
The FDA is set to authorize Pfizer vaccine for children 12 to 15 by early next week. Wouldn't it be better to vaccinate the population in schools? If so, what approval are needed from parents? Are those 16 plus able to opt to take a vaccine even if their parents do not approve? No.
You want me to
So,
do two in a row?
Go for it.
go ahead.
Yeah, so it kind of goes back to the other question. Yes, we think that one way, a really good way to reach those kids is to vaccinate them in school because they're in school. And so that's absolutely the strategy that we're already approaching. And the way that we're dealing with consent is that we have consent forms that get sent to the parents in advance, and the child has to bring them in signed, and a child in the school will not be vaccinated unless there's a signed consent form. It can't be a phone consent. It can be if the parent decides to come with the child and be present, that's okay as well. But if not, the kids have to bring in a signed consent form. And the plan is once the vaccine gets approved for 12 to 15-year-olds, that we'll be able to do that for those age groups as well. So right now we're just doing 16 and 17-year-olds and 18-year-olds, but 18-year-olds can consent for themselves, and then we're going to expand to 12 to 15 as soon as that's approved.
If the FDA full approval is given to Pfizer, will it be only for age 16 and over, or would it be 12 and over if 12 to 15-year-old approval goes through? Wondering when this will not be an emergency use and shut down that issue as an opposition to getting a shot.
Yeah. So we'll have to kind of wait and see. I would expect that it's going to be stepwise, that they will do the 16 and over first, and then they'll do the 12 to 15, because in order to get the full authorization, there are extra steps beyond which are required for the emergency use authorization. And so I don't know for certain, but I expect it'll be a two-step process.
Not sure if this is new, but vaccine.gov shows which vaccines are currently available by location. It does not appear to show city or county sites. Is there a one-stop shop for information?
I know that there's a lot of sites in development. If you go to some of the state sites, the state health department sites, then you can see, sometimes you can get a better picture of all the different vaccine sites in Texas. But I know that sometimes it's hard, especially when the locations vary week by week. And now as a country, we're trying to go away from the vaccine hub model and more into a community model, and there's going to be more and more sites. And so I think it'll be a little bit difficult to have every single site available on a site, because they change on a day-to-day basis, and sometimes they occur really rapidly. For example, we may be invited to go to a church one weekend, and it may be that those don't make it up into the websites, but at least all the big hubs you can find on the state websites. You can also find on Ready Harris, .org. You can find it on the Harris County Public Health sites. But I did notice that vaccine.gov, for whatever reason, currently does not include any of the county or city sites, and that's something that we'll definitely look into.
But on the city and county website, on the city's website, we also have the county's website or a link to get vaccination through the county. So I think the good thing about what you're saying is that vaccine will be more readily available. Right now, it's more readily available at pharmacies and is going in. That's really the norm that we want to support.
Absolutely.
What are the statistics on long haulers in the younger population?
So I'll take a stab at this, but Dr. Rivera may have some more data. So one thing we know is that the long haul symptoms in children is a real thing. We focus a lot of attention on obviously acute illness for kids requiring hospitalization, and in particular ICU hospitalization. We spend a lot of time talking about the multi-organ inflammatory syndrome that is seen in children. That is also seen a little bit in adults, but predominantly in children, and that causes things. The long haul is, these are the not devastating types of symptoms, but they're significant symptoms that last for weeks and months. We're also seeing that in children as well. But with all of these, the numbers, the percentage of individuals that are suffering these complications compared to adults is much, much, much smaller, but it's not zero. And one of the concerns that we have with the kids is that these symptoms are a reflection of the opportunity for potential permanent damage to some tissues. Now, we are seeing some of that with the MIC complications, some permanent damage to tissues. We're not seeing it as much that I know of with the long haul symptoms, but of course with kids, if there's even a little bit of damage, it could have a potentially greater effect, decades later. So the numbers remain really small. I don't have any specific numbers. I can tell you that currently in Harris County, the number of children admitted to hospitals is very small, at maybe a dozen or less. So, Dr. Rivera, I don't know if you have anything specific about the long haulers and children.
No, just that some of the early data, and this is still something that's being studied, this specific question, but some of the early data is potentially suggesting that teenagers tend to have more long haul symptoms than some of the younger kids, and in general, the older kids tend to have more symptoms with COVID-19 infection, and so it's not surprising that they would have more long haul symptoms. But if you start really looking into everyone who had a symptomatic COVID-19 infection, at least fatigue and decreased energy level does seem to be a pretty common symptom that kids are complaining about, some even several months down the line. And so I think some of the more concerning symptoms that we see in adults are not as prominent in kids, but that kind of fatigue, decreased energy level, brain fog does seem to be pretty prominent even in kids and especially in teenagers.
And let me just update one thing. While you were talking, I looked it up because I've got access to it. So in Harris County, there are 21 children that are admitted to hospitals right now, compared to 10,000 adults, by the way.
Wow. Those who endured lockdowns and other social restrictions will be left.
Hang on, I got to correct that. No. There's about 430 adults that are admitted with COVID out of a total population of 10,000 people admitted to hospitals. Sorry.
Okay. Those who endured lockdowns and other social restrictions will be left with major trauma that will take generations to get past. That's a comment. I think it really depends on the person and, what that adjustment period looks like,
Yeah, I do think that there is a sense of generational trauma, and we know that the rates of mental health issues have significantly increased during the pandemic. And so, yeah, I think that even in some people that may not be realizing it, there is a concern among mental health professionals, especially in public health professionals, about what are some of the effects that we're going to see down the line. I think in some ways it's going to build resilience in our communities, and then in other ways we're definitely going to see some mental health issues and complications down the road.
Months after recuperating from the virus, a new study says COVID affects multiple organs. People are more likely to die from it than those who were not infected and are likely to develop persistent health issues that require long-term care.
Yeah, so this kind of touches on what I touched on earlier, is that, I did it when I touched, I was really with the MIC or MIS in children. But here's the thing, is that this virus, as we know, doesn't follow any of the rules of most viruses. So, the cold virus is usually in your nose and sinuses, and that's about it. The flu virus is mostly, your muscles and body aches and fever, and sometimes in your lungs, and that's about it. Those viruses generally don't tend to directly affect your brain, your heart, your liver, your kidneys, your intestines, your skin. This virus can impact any one of those organs. And what we are finding is that some folks who get ill and get better are continuing to have some residual problems. We're seeing that in all these organs: liver, kidney, heart, brain. And so we're going to have to wait and see what sort of an impact that has, decades from now. But I anticipate that there will be a subset of patients in the future that doctors will be focusing on who are just having complications from the COVID-19 infection that they got years before.
Okay, adults under 50 make up 35% of all hospital admissions. In Seattle, more people in their 20s are hospitalized than those in their 70s. Is this true for Houston? I think you just quoted the numbers, but those were for the young children, right?
Yeah, those are for the under 16 and under. I believe it's either 16 or 18. I think it's 16 and under.
Yeah, and I think that when I last looked at the numbers earlier this week, I don't know that the 20-year-olds truly surpass the older population at this point in Harris County, but when you look at the number of 20-year-olds that should be in the hospital versus compared to the other groups, they are disproportionately affected. And so that means that there's more young people being hospitalized than is expected. And we also know that when you look at the vaccination numbers, there's fewer young people vaccinated than the older population. And so it's not surprising that we're moving towards the people getting hospitalized being younger and younger.
What is viral fusion peptide?
Oh, sure, that one would fall to me.
Dr.
What you got there is your, let me put on my Cliff Clavin. I'm not going to try to answer that. I don't know.
It's so the viral fusion, I have very basic this much knowledge on it. But it's basically a protein on the outside of a virus that helps a virus enter the cell. And I think that the reason they're asking about it is because the spike protein in the SARS-CoV-2 virus is a type of viral fusion protein. And when they study it, it doesn't seem to follow the typical characteristics of that type of protein. And that's as far as I got.
We're going to send Persse back to med school, all right?
That wasn't on the emergency medicine boards.
We're going to check and see, David. Okay. COVID nails. Allegedly, horizontal grooves or indentations may show you've had COVID, but can't other diseases make that happen?
Okay. So this also wasn't on the emergency medicine boards, but I do know that, horizontal grooves and indentations and nails in fact, there are a number of different illnesses that you can get clues about that the patient may be suffering from examining the fingernails. And one of the more common things that causes grooves, because remember, your nails grow out, right? And so when you get grooves, that indicates that for a time that you weren't forming the nail as thick as during other times. And so there are a variety of illnesses that can cause that, and one of them is just simply poor nutrition. But there are multiple things that can cause that.
Okay, I'm going to go fast for the last 4 questions because I've gone over a little bit. Dr. Nathan, the president of Washington State Medical Association says to tell people not to be afraid of dying, but to be afraid of heart failure, lung damage, and not being able to do the things that you love to do. Can you think of any better way to try to convince someone you care about to get a vaccine? Not sure about that.
Yeah, so there is do we scare people into the vaccine, or are there other methods? I think one really positive way to do it is, especially if people aren't back to their day-to-day, or there's people in their surroundings that aren't back to their pre-COVID activities, it's that the vaccine is a way for all of us to get back to quote-unquote normal. It's a way for all of us to start enjoying all the things that we want to do. If we as a population don't start vaccinating everyone, then there's still going to be restrictions throughout the country. So even if in Texas there's fewer restrictions, when you go to other parts of the country, you might still have those restrictions, and you're playing a part in that. If you want to travel to other countries and you're not vaccinated, I think there'll come a point where you're not going to be allowed to enter. And so it really, I think, thinking about the vaccine as a way to open up your possibilities in addition to protecting others is one way to approach it.
CVS and Walgreens have wasted more than 125,000 doses out of the total doses of 182 as of March 1. I assume they do not pay for the vaccine but are compensated for giving the shots. There are no incentives for how many are saved. Was this poor planning, delivery surprises, or storage issues?
Yeah. So I don't really know the answer to that at all.
I think that is going to become an issue, and it's going to be really kind of a jockeying game. I've been looking at Texas from some of my colleagues from around the state talking about that. Part of that is related to the demand now, and really projecting exactly how much you're going to use within a given day, within a certain time. So there are concerns about that, and we're trying to do the best that we can. Vaccine waste is recorded through VTRIC and Tiberius, but 15 states, including Texas, are not included in the CDC's data. Texas has the most wasted doses of any state. Is this freezer issues or no-shows? Are those wasted preventable? I think we just kind of commented on some of the dynamics related to that. India's Covaxin was effective against three variables: UK, Brazil, and India. Is this available or being looked at outside of India?
I've not heard that they put forth a emergency use authorization request to the FDA. I've not heard that yet.
Hey,
No.
the last one is actually a good one. West Virginia's governor said they're offering a $100 savings bond to residents 16 to 35 who choose to be vaccinated. What do you think of this incentive and others by various stores and companies, like a Shipley's a day?
Yeah, so it's something that's being considered and is being started in some places. So in the county, during our last commissioner's court, the court authorized a certain amount of money to be used towards incentives. And so essentially, if you show up to get the vaccine, they partner with local businesses and others, where if you show up to get the vaccine, you get entered into the potential to win multiple different things. And I know that there is an event this weekend, I believe it's Methodist Hospital at Minute Maid Park, where if you go and you receive a vaccine, you're entered to get some tickets to the next Astros game, and it's going to be right before the Astros game. And so I think that this is something that's definitely being discussed for those people that are still a little bit hesitant or a little bit skeptical about the vaccine, to start incentivizing them. And so that's something that is happening in the city and the county already.
I think the bottom line with this is that, we're really concerned about reaching herd immunity. And so we're really open to innovations and creativity to get to that herd. I want to thank you for joining us for COVID-19 Talk with local health authorities. With us is Dr. Maria Rivera, representing Harris County, Dr. David Persse, representing the City of Houston. Special thanks to Kathy Finninger, past president of Rotary Club of Houston, Morgan Ash, who is actually our producer, and I'm Stephen Williams, the director of the Houston Health Department. See you next week.